And you're welcome back. Research is revealing that the abuse of mercury by small-scale miners is beginning to expose Ghanaians to a lot of danger, including liver and kidney damage. Let's speak to Professor of Chemistry at the University of Ghana, Vincent Kojo-Nartey. Thank you, sir, for joining us in your inaugural address. You've been highlighting some of the major factors that are leading to this. Can you share some of them with us? And kindly unmute for us so that we're able to get the point you're making. Professor Nartey, if you're with us, you would have to first of all unmute because I'm unable to hear you at this point. So just unmute so we can get the point you're making, sir.
Yeah, can you now hear me?
Loud and clear. I was asking about some of the major points you were talking about.
Yeah, that's very good. That's very good.
Right.
Yeah, as you rightly said, mercury is of great concern, or should be of great concern to us here now, because we are all aware of what is happening in our mining sector, especially with the illegal mining. And to some extent, the small-scale mining is also involved so far as mercury usage is concerned. And over time, the measures have been put in place by government, but in fact, enforcement is a very great problem. And if you get on the field, you just see that these miners dispose of mercury in whatever manner they want, into our rivers, into the soils, and you can just know the consequences of that. When it gets into our rivers, in fact, our fishes take it up, and when it gets into our soils, our plants also absorb it. And eventually, all these are things which we eat. And the final culprit is actually we, the human beings. And mercury, as I said yesterday, has a very devastating effect on the health of the individual who has the exposure. And our organs, unfortunately, are the first target because when it gets into the body, it is the organs who suffer. And it takes some time for the manifestation to come before the symptoms are seen. And for that matter, we are not worried that, in fact, or do not know immediately the cause that it is to the symptoms that we suffer. But when you look critically, you observe that it is coming from the mercury pollution which our people are suffering. And of late, a lot of reports are coming about strange diseases being seen in our mining communities. And if you watch critically, they are all coming from the mercury, and for that matter, in fact, unwanted disposal of heavy metals in the environment. And so I think if nothing is done about this, in fact, sooner or later, we are going to be in serious trouble because, as I espoused, the effects are quite devastating. And the misfortune is it's quite silent. So people don't think and see it immediately. And unfortunately for the sector, you see the environmental destruction, which is very readily seen, being the destruction of the farmlands and the cocoa farms and all those things, we see and quickly address. But these metals, which are being disposed of into the environment, the eye cannot see them, but the body is taking them up. So my appeal strongly goes that, in fact, there is a need for us to mount on a crusade in this particular field to be able to test for the heavy metal levels, in fact, in our soils, in our waters, and almost everywhere, so far as our human existence is concerned, in the mining communities. And the danger too is, well, those of us who may not be in the mining communities may think we are not affected, but we are affected because the metal is such that it is being carried, in fact, continuously by our rivers, even downstream. You may be far up, okay, or you may have the effect immediately or tomorrow, so soon. But people who are down south, in fact, these heavy metals are being carried down, and it may take some time for the manifestations to be seen.
Okay, and on that score, what policy recommendations are you making for us to strictly tackle that?
As I espoused, you see, what meets the eye is being addressed, but what is invisible is not being addressed, because from our research, it's been seen that, in fact, mercury pollution is quite a problem in our mining communities. But mopping up can be done. And there are technologies now readily available for remediation. So there is a need to seek that and then put in place immediately. Otherwise, if it is allowed to continue, a time will come when what was visited on Minamata in Japan some time ago, or in some other parts of South Africa, South America, and other mining communities, we may also suffer that. And that is my concern.
If there's a message to those in authority, what would that message be in terms of how we could reverse the trend?
Okay. First and foremost, as I did mention yesterday, there must be the need for a concern by the public services institute to start testing on the levels of mercury as the miners or the people living in the communities may be exposed to. Now, that has already been established in some way through our researches. But then, more extensive data is needed to back what we are claiming. And if that is done, at least it will be a very strong or stronger wake-up call for us to start doing something about the scientific way of getting rid of the heavy metals with which the environment is being polluted.
I'm grateful.
There are ways of doing that.
Anyway, we'll continue this conversation sometime later. Thank you for now, Professor of Chemistry at the University of Ghana, Vincent Kojo Nartey. Thank you for your time. And that's all.